Hello, I'm Allie,
And I'm Annie.
and we are student physical therapist assistants from Carroll Community College. We are going to be discussing choreiform gait and how it presents in patients.
Okay, choreiform gait, also known as hyperkinetic gait, is typically present in basal ganglia disorders, including but not limited to Sydenham's chorea, Huntington's disease, and other forms of chorea.
Chorea comes from the Greek word for dance. It is distinguished by uncontrolled movements of the head, neck, arms, legs, and face. The trademark characteristics of this gait are jerky and involuntary movements, usually in both upper and lower extremities.
Due to cognitive difficulties when problem solving, these uncontrollable movements get worse with anxiety and frustration. So therefore you want to create a calming environment when treating a patient with chorea, which we'll discuss later during PT intervention.
Choreiform can show up in both genetic and non-genetic conditions. Genetic conditions associated with choreiform gait include but are not limited to Huntington's disease, metabolic disorders, pregnancy, also known as chorea gravidarum syndrome, and cerebral palsy.
Non-genetic conditions include medications like levodopa, neuroleptics, methadone, and oral contraception. Sydenham's chorea minor, cerebral toxoplasmosis from infection, and drug use like cocaine.
We are going to discuss choreiform gait in Huntington's disease because it is one of the more common diseases that present with choreiform gait. So in the case of Huntington's disease, which is an autosomal dominant neurodegenerative disorder affecting the basal ganglia of the brain, specifically the caudate nuclei, and other areas of the brain in later stages, we are going to look at the motor symptoms and deficits that occur with it. This disease will progressively worsen throughout a patient's life in early and middle stages and will cease during late stages. You'll start seeing signs of choreiform gait in the early stages of Huntington's, called the Huntington's dance, and will be at its worst during the middle stage.
So during the middle stage, patients will have difficulty swallowing, which leads to weight loss, and speaking, which can be addressed through speech therapy. Along with their frustration and anxiety, they develop obsessive compulsive tendencies. Their chorea will also cease during rest and sleep.
So here is a video of someone demonstrating and describing choreiform gait.
As opposed to the hypokinetic gait, we now have the hyperkinetic gait, which we see what we call a choreiform gait, or chorea. With this gait, there are not only abnormalities in the gait itself, but associated movements. There can be orofacial dyskinesias, in which the patient will be having movements of one side or the other side of the face, kind of a grimacing type of a fashion. There can be movements in the upper extremities, and there are fragments of semi-purposeful type of movements or writhing type of movements. And then the legs will also start to go. And so the patient attempts to walk in the superimposition of the movements, but the patient doesn't actually fall because the balance is not affected. Just you have these involuntary movements that are now being superimposed on the gait.
So now that you see how someone walks with choreiform gait, you can see that it is difficult to distinguish a step or swing phase as a concrete idea because choreiform gait is unpredictable.
So now we're going to discuss some physical therapy interventions. Let's see, when working with patients who present with choreiform gait, you want to remember a couple of things. One, you don't want to use assistive devices with these individuals because it could hinder their ambulation and progression. Two, create a calming and positive environment, consistency with treatment staff, quiet, secluded rooms with no other patients if possible in order to reduce anxiety and frustration. 3, improve their overall fitness, so strengthening for functional activities, balance, which we'll come back to in a moment, core stability for posture improvement, respiratory, We want to teach these individuals diaphragmatic breathing and coughing to promote oxygen flow and to prevent pneumonia and other lung infection, respectively.
So balance will be affected because as chorea intensifies in Huntington's disease, their center of gravity will constantly change during ambulation, putting their center of gravity outside their base of support. And in some cases, their balance will not be affected. These cases were not as easy to find, but did include some studies about weighing down either the individual with a weighted belt or weighing down an assistive device.
And here's a video of someone with Huntington's disease, and you can see how it looks like it would be, she would be unsteady on her feet, but she is able to move, stand up, pick up a chair and move it without falling. And while moving the chair, she even looked like she stopped having the jerky involuntary movements when she is loading her body, picking up the chair.
Earlier intervention is key, so if they have a support system and live with family, you can educate them on what will help at home. Like we mentioned earlier, we want to create a calming environment to reduce their anxiety and therefore the severity of the chorea, and maybe have someone there with you that they trust. You want to make their sessions as uniform as possible as far as people present, and environmental factors. And exercises you want to work on would be closed chain exercises where the distal limb is fixed. Like we showed you before with the lady with Huntington's disease, when she was squatting down to pick up the chair, she moved with less choreiform movement. And then of course, the Nintendo Wii. We've used this in clinics for balance and coordination, and surely you could use this with patients to try and work on these things.
So we said not to use an assistive device with this gait. However, there were some instances where some devices proved helpful in preventing falls and more stable gait pattern. These devices are a U-step walker, which is pretty much a rollator with a laser going across the bottom to help with step-through gait, and then a weighted rollator, again, talking about weighing down the individual to help with improved motor control. So you can see the U-step walker down here and the little laser going across right there. And these are our references.